Hi, everyone. We're back again. I'm Dr. Lori Cudone, and I thought I'd come back and visit you and we could have a little chat about allergy. Now is the time of year where a lot of people are suffering with allergy symptoms and have questions as to why is it that they're having such trouble and also what they can do about that. I've got a little presentation for you here, and I thought what we'd first do is talk about why you are having the troubles you're having. Well, it all comes down to the immune system. The immune system is meant to protect us from harmful substances in the environment. That means things like um, viruses, bacteria, cancer. Those are the things that our immune system is meant to protect us from. Unfortunately, sometimes the immune system gets a little confused and thinks that some of the things like pollen, dog hair, dust are dangerous. And so the immune system becomes activated. Well, when the immune system is activated by a type of molecule, that molecule is called an allergen. And when we are exposed to an allergen that we're sensitive to, our immune system will start to defend us against that allergen. There are two different types, or two different divisions, I should say, of the immune system. And those are the innate immune system and the adaptive immune system. And I promise I'm not going to get into a whole lot of detail. The innate immune system is not dependent on what you're exposed to. You could be exposed to dust, you could be exposed to a virus or bacteria, and maybe not even allergic to whatever it is that's bothering you. The part of the immune system that's innate are things like barriers, like the lining of your nose, your mouth, the skin. It keeps things from getting into your body. The mucus that you have in your nose and in your throat, your mouth, that will catch some of the things that you breathe in or you bring in by your mouth and will rinse them away. So it doesn't matter what it is, it's going to rinse whatever it is away. And one of the other things that we have in the innate immune system is our cells that will take those things that get in that don't belong and kind of eat them up and take them away like little garbage men. In the adaptive immune system, that's the part of the immune system that's programmed and that's very specific for what we are reacting to. So if you're allergic to a dog, the things that happen when you're exposed to the dog antigen are very, very specific. We have a bunch of different cells in our immune system, and we're only going to touch on a couple. The first one we're going to talk about is the plasma cell. The plasma cell is what makes antibodies. Everybody's heard of antibodies with the COVID virus, and these are the cells that are going to produce the antibodies against the antigens. So the antigen is what we're fighting against, and the antibodies are some of the molecules that are produced by the plasma cells that help us to fight. Plasma cells make these antibodies, and here you can see 5 of the different types of antibodies that are made: IgG, IgE, IgD, M, and A, those 5. IgE is the antibody that is active in allergy. So when you have a plasma cell that's activated and it starts cooking up some antibodies, these are the type of antibodies that are made. Those antibodies, and you can see our little plasma cell there that are making the antibodies, those antibodies will attach to something called a mast cell. The mast cell has a whole bunch of different granules inside it that are released when it's activated. What happens is the plasma cell senses the antigen, it makes antibodies against that antigen that are given to the mast cell, and the mast cell puts them on its surface, just waiting for one of those antigens to attach. Now, these cells are made in the bone marrow, and then they go into the blood to travel to where they're going to go. And in the blood, they're immature, so they're babies. They get to whatever tissue they get to. That could be your skin, it could be in your nose, it could be anywhere in your body. And once they get there, they grow up and then they just hang out and wait for an antigen to show up. Now, this is a pretty busy slide, and it doesn't really matter the list of these things, but this gives you an idea of all the different chemicals that are in a mast cell. And these chemicals go and bring information to other cells and will also make changes. So the things in the mast cell that we are concerned with in this talk are histamine, prostaglandins, leukotrienes, and then that last little thing there, the mast cell attractants, that just means that they send out a signal to other mast cells to come. And so that's why over time, sometimes your allergy symptoms can grow and become worse because they're sending information out, calling friends to come and help. Histamine, and most people have heard of antihistamines. That's a medicine that helps to go against the changes that are brought on by histamine. The histamine will dilate blood vessels. So if you, let's say you touch something that you're allergic to and your skin swells and you get a rash, well, those are the blood vessels that are swelling and they become a little leaky. And so some of the fluid comes out, so you get some swelling, and the increased blood flow to the area makes it red and warm. It also narrows the airways, because if you're trying to keep things out, if they narrow the airway, if the histamine narrows the airways, then the less will get in. Also, it causes a cough, sometimes sneezing, and that's to help expel some of those things. There's also changes in the nerve chemistry around where the histamine is released, and that causes itching and sometimes pain. It's something that if you've got something on your skin and it becomes itchy, you try and scratch it off. It's just a way for the mast cells to, again, clear this thing that's supposed to be dangerous. Prostaglandins are another type of chemical, and they do pretty much a lot of the same things. Blood vessels dilate and become leaky. There's, there is bronchoconstriction or narrowing of those airways with coughing, just like that, and pain. Leukotrienes, again, pretty much the same stuff. It causes also increased mucus, and we've already talked about them calling their friends. So these are the things that happen with your release of those granules from a mast cell. Our poor little guy on the right there has swollen lips, and you can see he's got a rash on his chest. That eye on the left side shows some redness, dilated blood vessels, and then the poor little lady up there is sneezing her head off because of these allergy symptoms. So what do we do? So the things that we can do for these symptoms is to take medicine. Like I said before, the antihistamines work against the things that happen because of the release of histamine. The prostaglandins, we use steroids to help with the changes caused by those chemicals as well. And the different ways of administering those steroids would be by taking them by mouth or using a nasal spray. The leukotrienes, I don't know if anybody's ever heard of Singulair, but that's a very popular medication that helps to change the things that happen because of exposure to leukotrienes. There's a new medicine there, called Dupixent, and that is used in folks that have really severe symptoms, also including asthma and changes in the skin as well. If medicines don't work, what we have is something called immunotherapy. Immunotherapy is what you talk about when you talk about allergy shots. We work to change the body's response to allergens. First, before we can use this, we have to do some allergy testing. The testing can be done with a blood test, which is not the preferred method. We'd rather do skin testing, and that's by skin prick, which is a screen, or intradermal testing. What happens with immunotherapy is, remember, we had that little guy in the center, that IgE that causes all the trouble, makes the mast cells release all those granules. Well, we try to produce what's called an antibody switch with the immunotherapy. We teach your body, instead of making IgE when you are exposed to whatever it is you're allergic to switch and start producing the IgG, that one that's off on the right. Excuse me. When we do that, you're not releasing mast cell granules anymore. It doesn't activate a mast cell. And so you still have the allergy, but your body is no longer releasing the chemicals that cause you to have all the bad symptoms. Now, the switch of the antibody from IgE to IgG can be either 100% in someone, it can be 50%, or there are those folks that don't switch at all. We do skin prick testing as phase 1 to just do a screen to see if there are any things that you are really allergic to. And then we do actually intradermal testing in order to quantify how allergic you are to that antigen. We usually do a panel of about 38 antigens. And that way we can use this information to mix your serum for the allergy shots. So the information that we get from testing is used to develop the injections that you get, or there is another way of receiving immunotherapy, and that's by doing drops under the tongue with the same type of serum, but that has to be done every day, and insurance coverage is kind of spotty for that. It can take up to 6 months for you to see an improvement. It depends on how quick your body is to do that switch. We want to at least wait 6 months to make sure that you aren't a responder before we stop therapy. This isn't a short-term therapy either. It's 3 to 5 years once you reach maintenance, which is the maximum dose that we can give you. So that's the presentation on allergies tonight. Thanks so much for being with us. In your own journey of getting relief from your allergy symptoms, you can see your primary care doctor, because oftentimes they can help you with the medications and deciding which ones work best for you. If that doesn't bring you the relief that you need, we're always here for you. You're welcome to have your primary care refer you to our office where we can go beyond just the medications, talk about immunotherapy or other options available to you. Thanks so much for joining me tonight, and have a wonderful evening.